In this session, we will deal with the larynx. So these are the highlights which we are going to see. So location of the larynx is in the anterior midline of the neck, extend from the root of the tongue to the trachea, that is vertebral level C3 to C6. Length. So if you see in males, the length, if you see in females, the length is 36 millimeter. In males, it is 44 millimeter. So transverse diameter in females it is 41 millimeter. In males it is 43 millimeter. Anteroposterior diameter in females it is 26 millimeter, and in males it is 36 millimeter. So there are total 9 cartilages. Unpaired cartilages are thyroid, cricoid, and epiglottis, and paired cartilages are arytenoid, corniculate, and cuneiform. There are a few joints within the larynx. The cricothyroid joint, which is plain synovial type, cricoarytenoid joint, which is plain synovial type, arytenocorniculate joint, synovial or cartilaginous. So these are the few important ligaments and membranes. Like extrinsic ligaments are thyroid membrane and ligaments, cricotracheal ligament, epiglottic ligament, hyoepiglottic ligament, cricothyroid ligament. Intrinsic ligaments are cricovocal membrane, vocal ligament, quadrangular membrane, vestibular ligaments. So muscles, intrinsic muscles, we concentrate mostly on these intrinsic muscles, namely the cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, epiglotticus, thyroarytenoid, thyroepiglotticus, and vocalis. So if you see, the extent is from C3 to C6 vertebrae. You can see here, this is the hyoid bone. You can see this is the epiglottis, this is thyroid cartilage, this is the cricoid cartilage. You can see the outline of the thyroid gland here. So functions of the larynx, it functions as air passage, phonation, protective sphincter, and deglutition. See here, the labeling is wrong. So it is the outline of thyroid gland, not the thyroid cartilage. This is the thyroid cartilage, this is the outline of the thyroid gland. So growth of the larynx in females is slow and hence voice is high pitched. In males, larynx shows pubertal growth, which makes angle of thyroid cartilage, that is Adam's apple, more prominent. Hence in adult males, voice is deep and low pitched. Skeleton of the larynx consists of cartilages, ligaments, and fibrous membranes, joints, and muscles, as I have shown earlier. Cartilages of the larynx. 9 cartilages are present in larynx, 3 paired and 3 unpaired. Unpaired cartilages are cricoid, epiglottis, thyroid. Paired cartilages are arytenoid, corniculate, and cuneiform. You can see here, this is the thyroid cartilage, this is the cricoid cartilage. There is an additional cartilage called cartilago triticiae, which within the lateral thyroid ligament. Cartilago triticiae. You can see here, this is the epiglottis, this is the thyroid cartilage, this is the arytenoid cartilage, this is the cricoid cartilage. You can see the corniculate cartilages. Cuneiform will be in the aryepiglottic fold. You can see here, this is the cricothyroid joint, this is the cricoarytenoid joint, this is the arytenocorniculate joint. So thyroid cartilage, the thyroid cartilage is shield shaped. It is made up of hyaline cartilage, consists of 2 laminae. So each lamina, the borders are like upper border, convex or concave, and there will be attachment of thyroid membrane. The lower border, there will be attachment of conus elasticus and cricothyroid muscle. And posterior border, insertion of 3 muscles, namely the palatopharyngeus, salpingopharyngeus, and stylopharyngeus. Horns, there is a superior horn and an inferior horn. Superior horn, lateral thyroid ligament is attached. Inferior horn, synovial cricothyroid joint. Inferior horn forms synovial cricothyroid joint with the cricoid cartilage. Outer surfaces, outer surface, there is an oblique ridge. So in relation to that, there will be attachment of thyroid, sternothyroid, and inferior constrictor muscle. So inner surface, there will be attachment of thyroepiglottic ligament, vestibular ligament, vocal ligament. There will be attachment of vocalis muscle and thyroarytenoid muscle. You can see here, this is the fused anterior border forming the laryngeal prominence. This is the upper border, convex or concave. You can see here, this is the superior horn, this is the inferior horn, this is the Adam's apple. These are the laminae of the thyroid cartilage. So this is the upper border, this is the lower border, this is the anterior border. So this is the oblique line on the outer surface. You can see this is the posterior border. So this is the cricoid cartilage. You can see here, this is the anterior arch and this is the posterior lamina. So on the upper surface of the posterior lamina, you can see the facet for articulation with the arytenoid cartilage. You can see here on the lateral surface, there is facet for articulation with the thyroid cartilage. So the arch is having an upper border, outer surface, lower border, and inner surface. You can see here that this is the facet for articulation with the arytenoid cartilage. This is the posterior lamina of the cricoid cartilage, and this is the anterior arch of the cricoid cartilage. This is the lateral view. So posterior view, you can see the posterior surface is divided into 2 halves. You can see the upper border of the lamina and you can see the lower border of the lamina. So you can see the attachment of cricothyroid muscle to the anterior arch. You can also see the cricopharyngeus part of the inferior constrictor muscle attachment here. You can see the attachment of cricovocal membrane or cricothyroid ligament, and you can also see the cricotracheal ligament attachment. So on the posterior surface, you can see the attachment of posterior cricoarytenoid muscle and the trachealis muscle. Here you can see the attachment of lateral cricoarytenoid muscle to the arch. So you can see this is leaf-like, epiglottis is leaf-like. So thyroid, if you see, Thyroid cartilage is shield-like. This is signet ring shaped, and if you see epiglottis, it is leaf-like. So you can see this is the right lateral view. You can see this is the anterior view or viewed in relation to the tongue, and you can see this is the posterior view or the laryngeal view. You can see there are two lateral borders. You can see this is the upper end, this is the lower end. So here you can see the arytenoid cartilage. So it is having an apex. You can see the colliculus. You can see the vocal process. You can see the muscular process. So apex, vocal process, and muscular process. You can see the anterolateral surface of the vocal process. You can see the medial surface of the vocal process. See here, this is the muscular process. This is the posterior view. You can see here on the apex there is articular facet for carnicular cartilage. You can see close to the base of the arytenoid cartilage. You can see there is a facet for articulation with the cricoid cartilage. Carniculate cartilage or Santorni cartilage. You can see here there is the carniculate cartilage. So two conical nodules of elastic cartilage placed in epiglottic folds. They articulate with the arytenoid cartilages. Cuneiform cartilage or Wrisberg cartilage. Two small elongated club-like nodules of elastic cartilage. They lie in epiglottic folds and visible as whitish elevations through mucosa. So triteciate cartilage or cartilago triteciae. So these are two small elastic cartilages situated along posterior border of the thyroid membrane, that is along the lateral thyroid ligament. Histology of the laryngeal cartilages. So there are few hyaline cartilages, namely the thyroid, cricoid, and arytenoid. Elastic cartilages are epiglottis, carniculate, cuneiform, and process of the arytenoid cartilage. Hyaline cartilages of larynx starts ossifying at the age of 18 years. Elastic cartilages of larynx do not ossify. So joints of the larynx: cricothyroid joint, plain synovial joint between inferior corner of the thyroid cartilage and side of the cricoid cartilage. They permit rotatory and gliding movements. Cricoarytenoid joint, it's a plain synovial joint between base of the arytenoid and lamina of cricoid cartilage, permits rotatory and gliding movements. Arytenocorniculate joint, synovial or cartilaginous joint between arytenoid and corniculate cartilage. Joints of the larynx are supplied by the recurrent laryngeal nerve. You can see here this is the arytenocorniculate joint, this is the cricoarytenoid joint, and this will be the cricothyroid joint. Ligaments and membranes. The skeletal framework of the larynx supported by following ligaments and membranes. The eccentric ligaments are thyroid membrane and ligaments between thyroid cartilage and the hyoid bone. Cricotracheal ligament between the cricoid cartilage and the trachea. Thyroepiglottic ligament between the epiglottis and thyroid cartilage. Hyoepiglottic ligament and between the hyoid bone and epiglottis. And you can see the cricothyroid ligament. Intrinsic ligaments include the cricovocal membrane, cricovocal between cricoid cartilage and vocal ligament. So this is the cricovocal membrane. Then vocal ligaments, quadrangular membrane, and vestibular ligaments. You can see here this is the quadrangular membrane, this is the cricovocal membrane between the cricoid cartilage and the vocal ligament. So this is the cricovocal membrane. So this is the vocal ligament, upper thickened part of the cricovocal membrane. So this is the vestibular ligament. There is the lower border of the quadrangular membrane. You can see the thyroepiglottic ligament. Thyroepiglottic ligament. You can see the thyrohyoid membrane. So you can see here high epiglottic ligament between the anterior surface of the epiglottis and the hyoid bone. You can see the thyroepiglottic ligament attaching the lower end of the epiglottis to the thyroid lamina. You can see the cuneiform cartilage and corniculate cartilage. You can see this is the quadrangular membrane, the lower border of which is thickened to form the vestibular ligament. And you can see the cricovocal membrane, the upper border of which is thickened to form the vocal ligament. So this is labeling is wrong. So vocal ligament is for this and cricovocal membrane is for this. So ligaments and membranes of the larynx. So if you see thyroid membrane, so attached to the upper border of the thyroid cartilage, then upper border of the hyoid bone. Median and lateral thyroid ligaments, these are thickening of the thyroid membrane. Cricotracheal ligament attached to cricoid cartilage and first tracheal ring. Thyroepiglottic ligament, lower end of epiglottis and posterior surface of the thyroid angle. High epiglottic ligament, posterior aspect of the hyoid bone, anterior surface of the upper end of the epiglottis. Then cricothyroid ligament, lower part of the thyroid cartilage and cricoid cartilage. Quadrangular membrane, sides of the epiglottis, arytenoid cartilage. Then vestibular ligament, posterior surface of the thyroid cartilage, lateral surface of the arytenoid cartilage. Cricovocal membrane. So vestibular ligament, posterior surface of the thyroid cartilage and lateral surface of the arytenoid cartilage. Cricovocal membrane, upper part of the arch of the cricoid cartilage and posterior surface of the thyroid cartilage and vocal process of the arytenoid cartilage. Vocal ligament, posterior surface of the thyroid cartilage, it extends up to the vocal process of the arytenoid cartilage. So these are the attachments. So this you can understand by looking at this earlier diagrams. Muscles of the larynx are grouped as extrinsic and intrinsic muscles. Extrinsic muscles are paired muscles and move larynx as a whole. They are palatopharyngeus, salpingopharyngeus, stylopharyngeus, which are attached to the posterior border of the lamina of the thyroid cartilage, then thyroid and sternothyroid. So these are attached to one of the laryngeal cartilages and adjacent bones. So intrinsic muscles, these include the cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, aryepiglotticus, thyroarytenoid, thyroepiglotticus, and occalis. So let us see. Intrinsic muscles of the larynx: opens or closes laryngeal inlet, adducts or abducts vocal cords, lengthens or shortens vocal cords, increases or decreases tension in the vocal cords. This is the main function of the intrinsic muscles of the larynx. So mainly they help in the phonation and respiration. Innervation, motor supply. All intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. You can see here. So extrinsic muscle, there is a thyroid. You can see here this is one of the intrinsic muscle, cricothyroid. You can see here this is the thyropharyngeus and cricopharyngeal part of the inferior constrictor. You can see the long-term muscle of the esophagus. So here you can see this is the posterior cricoarytenoid. From cricoid cartilage to arytenoid cartilage, you can see the oblique arytenoid and you can see the transverse arytenoid. You can see the aryepiglotticus from arytenoid cartilage to the epiglottis. You can see here the occalis muscle. You can see here this is the thyroepiglotticus from thyroid cartilage to the epiglottis. You can see here thyroarytenoid from thyroid cartilage to the arytenoid. You can see here lateral cricoarytenoid. Lateral cricoarytenoid. So in last view, you can see thyroepiglotticus, thyroarytenoid, aryepiglotticus, lateral cricoarytenoid, aryepiglotticus, oblique arytenoid, transverse arytenoid, lateral cricoarytenoid, and posterior cricoarytenoid. This is the occalis muscle. Intrinsic muscles of the larynx. Let us see in detail about the origin, insertion, and actions. Nerve supply we already dealt it. So cricothyroid lies on outer surface of the larynx. Origin, lateral surface of arch of the cricoid cartilage. Fibers pass backward and upward. Insertion to the inferior corner of the thyroid cartilage and also to the lower border of the thyroid lamina. So action, increases tension in vocal folds, lengthening of the vocal folds. Posterior cricoarytenoid, triangular muscle. Origin is from posterior surface of cricoid lamina. Fibers run upward and laterally. Muscular process of the arytenoid cartilage. Insertion is to the muscular process of the arytenoid cartilage. The action is abduction of vocal folds. Only muscle to open the glottis. This is the safety muscle of the larynx. Safety muscle of the larynx. So if posterior cricoarytenoid is paralyzed, it will be very difficult to breathe. So that's why this is the abductor of vocal folds and this is the safety muscle of the larynx. Lateral cricoarytenoid, so attached to the upper border of the arch of the cricoid cartilage, fibers run upward and backward, inserted to muscular process of the arytenoid cartilage. So it causes adduction of vocal cords. Adduction of vocal cords. Transverse arytenoid, unpaired muscle. So posterior surface of one arytenoid cartilage, fibers run transversely to the other arytenoid cartilage or opposite arytenoid cartilage. Adduction of vocal cords. Oblique arytenoid, muscular process of one arytenoid cartilage, fibers run obliquely upwards to the apex of the opposite arytenoid cartilage. So adduction of vocal cords. Sphincter of the laryngeal inlet, adduction of aryepiglottic folds. So this is the action of the oblique arytenoid. So aryepiglotticus, name itself speaks, from arytenoid to epiglottis. So upward continuation of some of the fibers of the oblique arytenoid, insertion to the edge of epiglottis, adduction of vocal cords, sphincter of laryngeal inlet, adduction of aryepiglotticus. So aryepiglotticus and oblique arytenoid, they are mainly concerned with the sphincter action of the laryngeal inlet, adduction of the aryepiglottic folds. So thyroarytenoid, so angle of the origin from the angle of thyroid cartilage and adjacent cricoid ligaments, cricothyroid ligament, fibers run upward and backward, insertion to the anterolateral surface of the arytenoid cartilage. So relaxation of the vocal cords. Thyroepiglotticus, fibers of the thyroarytenoid extend upward as thyroepiglotticus. So insertion to the edge of epiglottis. So wider inlet of larynx by acting on aryepiglottic folds. Widens the inlet of larynx by acting on aryepiglottic folds. Occalis, vocal process of the arytenoid cartilage, fibers pass forward, vocal ligament and angle of the thyroid cartilage. Increases tension in vocal cords and changes the tone of the voice. So action of the cricoid cartilage, you can see the classical view, like cricoid is pulled up and arytenoid is made to go posteriorly or displaced posteriorly, tensing the vocal cords. So if you see the Negus view, so cricothyroid contracts and the thyroid cartilage itself is moving forward, creating the tension in the vocal cords. So if you see here in classical view, cricoid moves and arytenoid goes backwards. So there is tension in the vocal cords. In Negus view, cricoid and arytenoid are stable. The thyroid itself moves, the thyroid cartilage itself moves forward, creating tension in the vocal cords. This is the action of the cricothyroid. So now you can see posterior cricoarytenoid, the only abductor of vocal cords, abduction of vocal ligaments. You can see here, this is the abduction of the vocal ligaments. So lateral cricoarytenoid, adduction of vocal ligaments. Transverse and oblique arytenoids also adduction of vocal ligaments. The vocalis and thyroarytenoid, shortening and relaxation of the vocal ligaments. So you can see here the direction of movement. So see the direction of action of the thyroarytenoid. You can see the direction of action of the vocalis. You can see the axis of rotation of the arytenoid. You can see the direction of action of lateral cricoarytenoid, and you can also see the action of posterior cricoarytenoid. Movements of the larynx. Elevation of the larynx is by thyroid and mylohyoid. Depression of the larynx is by sternothyroid and sternohyoid. Laryngeal inlet opening is by thyroepiglotticus. Laryngeal inlet closing is by aryepiglotticus. Movements of vocal cords, if you see, adduction, lateral cricoarytenoid, transverse and oblique arytenoids. Abduction is posterior cricoarytenoid only. Tension, cricothyroid and vocalis. Relaxation, thyroarytenoid, vocalis. Vocalis is helping both in tension as well as relaxation. So you can see the median position, the adduction, the cadaveric position and abducted position of the vocal cords. So you can see through laryngoscope, you can see this is the vocal fold, this is the vestibular fold, this is the rima glottis between the two vocal folds. So cavity of the larynx. So subdivisions of the cavity of larynx. So vestibule is above the vestibular fold. Ventricle or sinus of larynx is between the vestibular fold above and vocal folds below. Intraglottic compartment is below the vocal folds. So so inside, the most important things what you have to identify is the vestibular fold and vocal folds in the sagittal sections. Place between the area between the two vocal folds is called rima glottis, and the area between the two vestibular folds is called rima vestibuli. So here you can see the laryngeal inlet anteriorly bounded by the epiglottis, posteriorly by interarytenoid fold of mucous membrane, laterally by the aryepiglottic fold of mucous membrane. So extend from inlet of larynx to the lower border of the cricoid cartilage. So whatever we see from inlet of larynx to the lower border of cricoid cartilage, if you see in the lateral wall, the subdivisions are like this. The vestibule above the vestibular folds, the ventricle or sinus of larynx is between the vestibular fold and vocal folds. Below the vestibular folds is the infraglottic compartment. The space between two vestibular folds is called rima vestibuli, and the space between two vocal folds is the rima glottis. It is the shape of the rima glottis which determines the voice. So laryngeal inlet anteriorly bounded by epiglottis, posteriorly by the interarytenoid fold of mucous membrane, and laterally by the aryepiglottic fold of mucous membrane. The saccule of larynx, it is the upward extension of the anterior part of the sinus of larynx. It's also called as oil corner of larynx, contains mucus glands. Like if you see in the vocal folds, they don't have mucus glands. The vocal folds are lined by the stratified squamous epithelium. So for lubrication of the vocal folds or vocal cords, the secretions coming from the mucous glands present in the sinus of saccule of the larynx, which is an extension from the sinus of the larynx. You can see here. So this is the vestibule. So this is the intraglottic compartment. Between the two vestibular folds is the rima vestibuli. Between the two vocal folds is the rima glottis. Between the vestibular fold above and the vocal fold below, this is the sinus of the larynx, and you can see this is the extension from the sinus of larynx, that is the saccule of larynx. So mucus glands present here lubricate the vocal cords or vocal folds. You can see here vestibule, ventricle, and the intraglottic compartment. Sinus of larynx also called as laryngeal ventricle. So injury to external laryngeal nerve results in paralysis of the cricothyroid and weakness of the phonation. Then injury to recurrent laryngeal nerve, unilateral injury, vocal cord on side of the injury acquires paramedian position, does not vibrate, little or no effect on phonation as opposite vocal cords compensates. Bilateral injury, both the vocal cords acquire paramedian positions, loss of phonation and difficulty in breathing. Injury to both external and recurrent laryngeal nerve, in this situation vocal cords acquire abducted and fixed position due to paralysis of all intrinsic muscles of the larynx called correct position of the vocal cords. Laryngeal obstruction, if a foreign body enters the larynx, highly sensitive laryngeal mucosa induces explosive cough to expel foreign body. So due to neurological disorder, nerve injury or comatose patients, foreign body may obstruct airway passage, results in asphyxia and even death. So Heimlich maneuver. So in case of emergency in laryngeal obstruction by foreign body, as patient may die within minutes, foreign body should be removed using Heimlich maneuver. So procedure: stand behind patient, hold patient from behind by placing one hand formed into fist and the other hand holding first over epigastric region of the victim. Holding the fist over the epigastric region of the victim. So it is the fist. Fixed over the epigastric region of the victim. Give 3 to 4 abdominal thrusts directed upwards and backwards, so air from lungs will get squeezed and will help to expel out foreign body from the larynx. So here you can see the laryngosele. You can see here the internal laryngosele and external laryngosele. Saccule of the larynx forms air-filled cystic swelling because due to increased air pressure in trumpet players, glass blower, or weightlifters. So mucous membrane of larynx, interior of the larynx, lined by ciliate columnar epithelium, except the anterior surface and upper part of the posterior surface of the epiglottis, upper part of the epiglottic folds, and the vocal folds, where it is lined by stratified squamous epithelium, firmly adherent to vocal cords. Mucous glands are absent over vocal cords. Vocal cords have firm adherent mucosa without underlying vascular submucosa. Hence, laryngeal edema does not affect the vocal cords. So earlier I told you the lubrication of vocal cords is by the mucous gland secretion present in the saccule of the larynx. Arterial supply above the vocal cords, superior laryngeal branch of the superior thyroid artery, below the vocal cords, inferior laryngeal branch of the inferior thyroid artery. So venous drainage above vocal folds, superior laryngeal vein drains into superior thyroid vein, below the vocal folds, inferior laryngeal vein drains into inferior thyroid vein. Lymphatic drainage above vocal cords into upper deep cervical lymph nodes, below the vocal cords into lower deep cervical nodes. Innervation, motor supply, all anterior modes of the larynx supplied by the recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. Sensory supply, mucous membrane of the larynx supplied as follows: above vocal folds, interlaryngeal branch of the superior laryngeal nerve, below vocal folds, recurrent laryngeal nerve. You can see these are the different shapes of the rhemoglottis. Like if you see during quiet respiration, it is pentagonal in shape. So this is the intermembranous part and this is the intercartilaginous part. So during deep inspiration, it becomes diamond shaped. The rhemoglottis becomes diamond shaped. So during high pitched voice, it becomes linear chink, and during whispering, it becomes inverted funnel shaped. So these are the different shapes of the rhemoglottis during different respiratory and phonatory functions. So movements of the vocal cords and shape of rhemoglottis condition. If it is quiet breathing, intermembranous part is triangular, intercartilaginous rectangular, and rhemoglottis is pentagonal. Full inspiration, intermembranous part is triangular, intercartilaginous part is also triangular, wide diamond shaped. High pitched voice, intermembranous part rectangular, intercartilaginous rectangular, narrow rectangle. So whispering closed, intermembranous part is closed, whereas intercartilaginous part is wide triangle, it's inverted funnel shaped. So laryngoscopy is used to see the interior of the larynx. Direct laryngoscopy. So direct laryngoscopy is using fiber optic flexible laryngoscope or metal laryngoscope. Directly we can see the larynx. Indirect laryngoscopy is using a War mirror. So following structures are visualized on laryngoscopy: inlet of larynx, vestibular folds, vocal folds, and sinus of larynx. You can see here this is a laryngoscopic view of the vocal folds and the vestibular folds, and this is the sinus of the larynx. Laryngitis is the inflammation of the larynx, may produce hoarseness of voice. Laryngeal edema may cause airway obstruction. Laryngeal pain may get referred to ear through vagus nerve. Tumors of the vocal folds produce alteration in voice, hence get diagnosed early. Laryngotomy, emergency procedure like tracheostomy, so involves insertion of needle in larynx through cricothyroid membrane. Singer's nodules or teacher's nodules. Misuse of vocal cords may produce nodules at junction of anterior 1/3 and posterior 2/3 of the vocal folds. These are commonly observed in singers or teachers. So mechanism of phonation, complex and coordinated activity of production of sound, involves following coordinated process like expiration of air from lungs, vibration of the vocal cords, resonance of air column in the larynx and nose, and articulation of the tongue, lips, palate, pharynx, and teeth to modulate sound. Thank you.